Namaste. Welcome to today's session. In earlier modules, we have focused on structure and physiology of eye. In the upcoming modules, we will be discussing common eye problems where yoga can help. What are the common eye problems? Some of them are stress-related eye problems, errors of refraction, glaucoma, cataract, age-related macular disorders, diabetic retinopathy, autoimmune and allergy eye disorder. In this module, we are going to discuss stress-related eye problems. What is stress? How is stress related to eye problems? What are the common stress-related eye problems like dry eye, sty, eye strain, computer vision syndrome or digital eye strain, and evidence-based yoga solution for all these problems. What is stress? Stress is the body's response to any change that requires attention or action. Body reacts to these changes with physical, emotional, or psychological responses. Everyone experiences stress to some degree. The way you respond to stress, however, make a big difference in your overall well-being. The word stress is quite often used in a negative sense. But stress is a normal part of life. Stress is a common feeling we get when we feel under pressure or we are overwhelmed. Small amounts of stress can be good for us. It helps to cope up with the situations, helps one to be productive, creative, prepared for challenges, and stay motivated and focused. And it motivates us to achieve goals. For example, taking an exam or giving a speech. Stress can trigger the body's response to a perceived stress or danger known as fight or flight response. During this reaction, certain hormones like adrenaline and cortisol are released. This speeds the heart rate, slows digestion, shunts blood flow to major muscle groups, and changes various other autonomic nerve functions, giving the body a burst of energy and strength. When the perceived threat is gone, systems are designed to return to normal function via the relaxation response. But in cases of chronic stress, the relaxation response doesn't occur often enough, and being in a near constant state of fight or flight can cause damage to the body. When stress prolonged for a long time, when especially it feels out of control, can negatively impact our mood, physical and mental well-being and relationships. Stress can lead to some unhealthy habits that have a negative impact on your health. For example, many people cope with stress by eating too much or by smoking or watching television, mobile for longer time. These unhealthy habits damage the body and create bigger problems in the long term. If you feel intensely stressed in a way that interferes with daily life, we may be suffering from chronic stress. Symptoms are inability to concentrate, anxious or racing thoughts, constant worrying, feeling overwhelmed, chest pain, rapid heartbeat. Like any physical problem, it can get worse. Chronic stress is treatable, and with the right help, it can be managed. Now coming to how can stress cause eye problems. Prolonged mental stress is clearly a consequence of vision loss. It may also aggravate the situation. In fact, continuous stress and elevated cortisol levels negatively impact the eye and brain due to autonomic nervous system imbalance, especially the sympathetic, and vascular dysregulation. Hence, stress may also be one of the major causes of visual system diseases such as glaucoma and optic neuropathy. Some common eye problems due to stress are dry eye, Stye, eye strain, and computer vision syndrome, which has become so common, or digital eye strain. Dry eyes. Dry eye is a common condition that occurs when tears aren't able to provide adequate lubrication for eyes. Tears are necessary for lubricating and nourishing your eyes so that we can see clearly. Dry eyes occur when we have a lack of tears, and this can lead to severe discomfort. What are the symptoms of dry eye? Dry eye can cause a scratchy feeling, like as if there's something in the eye, stinging or burning feeling in your eye, red eyes, sensitivity to light, and blurry vision. Likewise, not blinking enough, such as when you stare at a computer screen for a long time, also leads to increased evaporation. Fortunately, in these instances, treating dry eyes naturally is the best course of action. Increasing your blinking or gently massaging with closed eyelids to increase tear production may lubricate your eyes. What is the treatment for dry eye? Treatment for dry eye usually depends on what's the symptom. Some of them are using eye drops. The most common treatment for mild dry eye is a type of eye drops called artificial tears. Consuming medicines. If dry eye is more serious, the ophthalmologist may provide prescription of medicines. Tear duct plugs. If tears are draining too quickly from your eyes, doctor may suggest putting special plugs, also known as punctal plugs, in the tear ducts, small holes in the inner corner of your eyes. The plugs can help keep your tears in your eyes. Surgery is also an option. Lifestyle changes such as avoiding smoke, wind and air conditioning, limiting screen time and taking breaks from staring at screens, wearing wraparound sunglasses when we are outside, drinking plenty of water, that is 8 to 10 glasses per day, getting enough sleep, about 7 to 8 hours a night, or giving proper rest to the eyes can help protect our eyes. At this present era, people have turned towards CAM or complementary and alternative medicine. Yoga as a part of the traditional Indian system is recognized as the foremost life science and describes various modalities to prevent and manage lifestyle disorders. Especially after this COVID pandemic, the world is being attracted towards CAM. Yoga not only a physical activity but also a complete science of living always remains in the forefront for combating various eye disorders. Yoga can be of great help in not only preventing but also controlling various eye diseases. There are many yogic practices such as Trataka, eye exercises, breathing practices, various relaxation techniques that help to improve the functioning of the eyes, overcome electronic toxicity, improve tear film of the eyes, hence reducing dry eyes and regaining elasticity of muscle leads to improved vision. Coming to another common condition, that is a stye. A stye is also known as pink eyes. It is a reddish lump on the outer edge of the eyelid. It is filled with pus and inflammatory cells produced when a clogged gland or follicle becomes infected. It's tender to touch and can be very painful. There are many types of styes. A stye can be on the outside called external or internal inside of the eyelid. External styes are much more common than internal styes. Most external styes start in an eyelash follicle. Occasionally, they start in an oil gland or the sebaceous gland. They are located on the outside edge of the eyelid. Internal styes, most of these begin in an oil, meibomian gland within your eyelid tissue. They push on your eye as they grow and tend to be more painful than external styes. Like a pimple, the pus produced by the infection within the stye usually comes to a head. It creates a beige or yellowish spot on top of the stye. What are the other symptoms? Eyelid swelling, yellowish discharge, sensitivity to light or photophobia, feeling like there's something in the eye, eyelid tenderness, a gritty feeling in the eye, watery eye, a crust that forms on the edge of the eyelid, and eyelid redness. What are the causes? There are several different types of stye, each with a different cause. Viruses, bacteria, or allergens commonly cause stye. Stye can refer to any inflammation or infection of the clear membrane that covers the eyelid. Other causes of the stye include environmental toxins such as smoke or dust, irritation from contact lenses, foreign bodies like dirt or an eyelash irritating the lining of the eye. On the other hand, an infection of the oil glands on the eyelid also causes styes. Styes are characterized by a red lump around the stye of the infected gland or eyelash follicle. These lumps can look like a pimple or a boil. Activities that introduce bacteria to the eye can lead to the stye, such as sleeping with makeup on, frequently rubbing your eyes, trying to extend the life of disposable contact lenses. What is the treatment for stye? In some cases of pink eye, we can use home remedies to relieve symptoms until the infection clears. Apply cold compress to the eye to reduce inflammation. Use artificial teardrops. Wash hands before touching the eyes. Washing all over bedding and avoid reinfecting the eyes. Avoid wearing contact lenses until infection or its symptoms are gone. If home treatment doesn't relieve the symptoms, we may need to see an eye doctor. They may prescribe antibiotic treatment for bacterial pink eye. Yogic practices consist of Om Trataka, Jyoti Trataka, Jatru Trataka, Netra Sanchalana, palming, asanas, pranayama, yoga nidra, meditation, devotional sessions, cleansing practices like Kapalabhati and Jalaneti. Pranic energization technique is an advanced technique of yoga developed by S. Vyasa, in which we use our prana shakti to energize our entire body. Each and every organ of our body can be revitalized in this process, which helps in strengthening the immunity. Mind sound resonance technique is one of the advanced yoga techniques for achieving the goal of positive health, willpower, concentration, good memory, and deep relaxation. MSRT generates resonance throughout the body by the repetition of mental sounds. This helps in revitalizing the internal energy of the body. These techniques will be discussed in detail in our practical sessions. Coming to the next problem, eye strain. Stye is commonly associated with eye strain. Eye strain is a common condition that occurs when eyes get tired from intense use, such as while driving long distances or staring at computer screens and other digital devices. Eye strain can be annoying, but it usually isn't serious. It goes away once we rest our eyes or take other steps to reduce our eye discomfort. In some cases, symptoms of eye strain can indicate an underlying eye condition that needs treatment. What are the symptoms? Sore or tired or burning or itchy eyes, watery or dry eyes, blurred or double vision, headache, sore neck, shoulders or back, increased sensitivity to light called as photophobia, difficulty concentrating, feeling that we cannot keep our eyes open. What are the common causes? They are looking at digital device screens. Now we have a very big problem. People are addicted to gadgets. It's either the mobile phone or the laptop or the tablet. reading without pausing to rest your eyes, driving long distances and doing other activities involving focusing for a long time, being exposed to bright light or glare, straining to see in very dim light, having an underlying eye problem such as dry eyes or uncorrected refractive error. You might be having a refractive error, and if not corrected it, that can cause tremendous eye strain, being stressed or fatigued, being exposed to dry moving air from a fan or a heating system or an air conditioning system. Extended use of computers or other digital devices is one of the common causes of eye strain. People who look at screens for more than few hours a day are at a great risk of developing this condition. Computer use strains eyes more than reading print material because people tend to blink less while using computers, and blinking is the key to moistening the eyes. View digital screens at less than ideal distances or angles, using devices that have glare or reflection, using devices with poor contrast between text and the background. In some cases, the underlying problem, such as eye muscle imbalance or uncorrected vision, can cause a worsened computer vision syndrome. Some other factors that can make the condition worse include glare on the screen, poor posture, setup of a computer workstation, circulating air such as fan or air conditioning. Kim Sang-dol in 2016 investigated the effect of yogic eye exercises on eye fatigue in undergraduate and nursing students. 40 undergraduate nursing students were selected from convenience sampling, with 20 assigned to the exercise group and 20 assigned to control group. They found that eye fatigue score was decreased in the exercise group compared to the control. The study findings say that yogic eye exercises could reduce eye fatigue score in undergraduate nursing students. The yogic eye exercise intervention was performed for 60 minutes, 2 days a week for 8 weeks. It consisted of 8 steps: palming, blinking, sideway viewing, front and sideway viewing, rotational viewing, up and down viewing, preliminary nose tip gazing, near and distant viewing. Various other studies also provide the same suggestion that eye fatigue score and intraocular pressure can be reduced after yogic ocular exercises. Blinking can increase spontaneous blinking reflex, induction, the relaxation muscles of the eye, prevent irritation and dryness of the eyes. Sideways viewing is useful for relaxation of the extraocular muscles which strain due to reading or doing close distance activity, preventing and fixing strabismus. Front and sideways viewing increase both eye coordination. Up and down viewing make rectus superior and inferior muscles become balanced. Preliminary nose tip improved accommodation and focus on the muscles of the eyes. Near and distant viewing likewise has nose tip preliminary, but the range of movement is greatly improved. Looking at far distance can relax extraocular muscles. Break interval and good quality picture can reduce fatigue of the extraocular muscles. Now coming to a very common condition of today, digital eye strain or computer vision syndrome. One of the most common problems faced today with the modern lifestyle is computer vision syndrome. Eye complaints due to seeing digital or computer screen, laptops, e-readers, tablets, smartphones for too long is known as digital eye strain or CVS or computer vision syndrome as described by the American Optometric Association. Computer vision syndrome is characterized by a range of eye and vision related symptoms and has been recognized as a health problem for recently, that is over just 20 years. Digital eye strain is a repetitive injury which occurs among 70% computer users and has occupied the first rank disease caused by work. The prevalence of digital eye strain was large enough, which is 20.9% in 2009 and 83% in 2021. The study concluded a prevalence of 75% versus 50% and was reported in another study comparing computer users and non-computer users. A study revealed that regular contact lens usage increased the risk of computer vision syndrome after 6 hours of computer usage. The prevalence of CVS in contact lens users was 65% in contrast to 50% in non-contact lens users. Another study reported that the symptoms were dose dependent and increased significantly with more than 4 hours of computer usage. Digital eye strain or computer vision syndrome. What are the symptoms? Eye fatigue, eye discomfort, dry eye, strain and irritation in the eye, blurred vision, reduced visual acuity, burning sensation, redness, pain around the eyes and double vision, headache, neck and shoulder pain. This condition is aggravated by pain and strain due to seeing digital screen or computer. These symptoms could be caused by poor lighting, glare on a digital screen, improper viewing distances, poor seating posture, uncorrected vision problems, a combination of these factors. How computer and like devices are responsible. The longer the use of computer leads to lesser blink reflex. That means we don't blink as much as we should. Normal blink rate is 16 to 20 per minute. With computer usage, it becomes 6 to 8 per minute. Blinking is critically important for spreading tears to form an even film on the eye surface. When we look at a distance, our eyes are relatively relaxed and at rest. But when we look at computer continuously, the pixels or computer on the screen do not have well-defined edges. They are brightest in the center and diminish in intensity towards the edges. This makes it difficult for eyes to maintain focus. Extensive focusing does not give much opportunity for the eye muscles to move. This causes eye strain, burning, tired, and eyes feeling of having fatigue in the eye muscles. Poor position in relation to computer causes of computer vision syndrome. Other contributing factors could be constant gazing at a near distance at the monitor, which leads to the convergence fatigue. Fixed posture while working long hours. The eye muscles do not get much opportunity to move. Uncorrected visual defects, glare from lighting in the workplace, and direct light coming in from the exterior. There are certain suboptimal properties of the digital devices. The blue light, especially the LED, light emitting diodes are known to emit blue light. This may cause damage to the retina. Circadian rhythm depends on exposure to light. Melatonin is secreted at night and plays a crucial part. Intrinsically photosensitive retinal ganglion cells or the melatonin containing cells play a critical role in the circadian rhythm by sending messages to the pineal gland. Thus, presentation of blue light not in sync with the sun may alter the coupling of the biological clock with the geographical clock of that area, resulting in an abnormal circadian rhythm and sleep pattern, which can lead to macular degeneration, it has been suggested. Further work is warranted in this area. People who have undergone cataract surgery show there is no apparent advantage of blue light filtering intraocular lens over non-blue light filtering lens. So a lot of work needs to be done in this area. Quality of display is another factor. Poor image stability, poor readability and legibility, high brightness and high contrast may cause blurring of characters. Words with capital letters are difficult to interpret compared to sentence case. Now coming to critical flicker fusion frequency is the refresh rate at which the human visual system fails to recognize the flickering nature of the screen, and the screen appears to be constantly illuminated. Other risk factors include use of electronic materials outside work, frequent switching between digital display and hard copy which have different backgrounds. Prevention or things to be done to minimize CVS. To begin with, who suspects CVS should have a thorough eye examination by an ophthalmologist. Apart from this, additional steps to be taken are blink more often. Computer users should make a conscious effort to blink more. Adjust the height of your seat and the computer screen distance from adjust and height of the desk or chair. Reduce the glare, direct and overhead lights away from the computer screens. Take a break while using computers to reduce fatigue and taking breaks from work. Yoga has been proven to improve the symptoms which occurred due to the use of computer for hours. Yoga practiced for 60 days will reduce uncomfortable feeling in the eyes, and it was shown in 291 computer users. Yoga practice for 6 weeks is effective to overcome emotion and stress. It increases blood circulation and nutrition to both eyes, so improve the health of the eyes. This will relax the extraocular muscle and return the original shape of the eyeball, which is important for normal vision. Important yogic interventions found to be effective by various studies to control CVS are yoga practices like asanas for 5 minutes, regulated breathing, that is pranayama, for 10 minutes, exercises for joint shitalikarana vyayama 20 minutes, visual cleansing exercises Trataka for 20 minutes, and guided relaxation are found to be effective. Few studies, yoga practices consisted of Om Trataka, Jyoti Trataka, Jatru Trataka, Netra Sanchalana, palming, asanas, pranayama, yoga nidra, meditation, devotional sessions, cleansing practices like Kapalabhati and Jalaneti. Eye movement, palming and Trataka improves vision, concentration, relaxes muscles and also impacts myopic eyes. Bhastrika pranayama and Kapalabhati pranayama cleanse the lungs, improve circulation. Jalaneti influences sense organs and strengthens vision. In our coming classes, we will be discussing other eye problems and evidence-based yoga as a solution, and also holistic approach of yoga therapy will be discussed in detail. Thank you so much for watching our program. Namaste.